Hi, this is Junaid, AINeuroCare stroke and epilepsy specialist. I see my patients with migraine at the worst time they can present with hemiplegic migraine in a hospital with a stroke mimic. I try to teach them these basic skills of migraine prevention, but given they're in the hospital, it's a distraught, heavy emotional situation, it is sometimes does not sink in. So therefore, I wanted to make a video so that they can understand what migraine prevention is. For the first thing we're going to talk about in this part one is the principles of disease management in self for all chronic diseases. And it applies for all chronic diseases. And one of the things that I wanted you to understand that this is a chronic disease. Okay, this is not something that is going to go away. This is not something that is curative. It is something that you have to manage for the rest of your life. So this is a complete mindset in terms of your disease process. It is not a flu that you're going to get over. It's not a bacterial infection you're going to get over. It is a chronic condition that you have to deal with day in and day out. So therefore, consistency is extremely important. In the part one, we're going to discuss medication management. Number two would be consistency and routine, which is extremely important. Measure to improve. If you're not going to measure, you're not going to be able to improve. Anticipate and abort. And then finally, recognize red flags. In part two of the talk, we're going to talk about lifestyle changes. Lifestyle changes are extremely important for both in this particular situation as far as migraine, but all chronic disease management as well. So number one is, of course, make sure you have the best sleep ever. Hydration, exercise, and de-stress. So these are the few things that we're going to talk about throughout the whole talks in two different parts. So let's talk about principle number one in chronic medication management. The most important thing is compliance. Again, I'm going to repeat that. This is not something that we are just treating and it's not curative. It is a lifestyle change that you have to make. It is very important that you're compliant with your prophylaxis medication, that you're compliant with your preventative medications. Because if you're not compliant with those medications, we cannot actually help you at all. So it's extremely important you take the medication on time and preferably on time daily at the same time if it is a daily medication. This way you can assure that we are doing the right things, and therefore when we have done that, then if we need to change something, we know that you have been compliant, it's not working, let's move to another medication or a combination of medications. But if compliance is not there, there's no way we can actually fix the problem. So let's start how we choose these medications. The selection process is unfortunately still quite haphazard. Unfortunately, it's trial and error. We don't have your genomics data that we can actually precisely do precision medicine yet, and we will have it one day. We're working actively towards precision medicine, and we'll have your genomic profile and we can exactly say that, okay, this is a medication for this person that's going to work best. But unfortunately, the current process is trial and error. We choose the first medication according to your risk profile, according to your comorbidities that you have. So if you have a hypertension, we're going to choose a different medication. If you have depression, another medication. If you're overweight, we can use another medication. So therefore, it is unfortunately trial and error. So bear with us, be patient. It takes time to find the right medication for you. And that actually requires a little bit of trial and error. What we do is we go to first therapy according to your comorbidities. We go to the max, and if it works, great. Well done. If it doesn't, move to second, then third, and then eventually move to a combination of medications. So that's the whole process. If you understand the process, then you're going to understand how important it is to actually measure. And if you're not going to measure, then we can't improve. So chronic medication management, the goal over here is to reduce the flares, to reduce the number of headaches, to increase the number of pain-free days. So the point is that in any situation, if you're doing diabetes, we want to decrease the hyperglycemic episodes. If you're having hypertension, that's the same thing. We want to decrease the hypertension spikes. If it's migraine, we're going to talk about decreasing the number of headaches. When we are choosing the medications or adjusting the medication, we try to change it from one type of mechanism of action to another one. Because if the first one didn't work, we don't want to use the same mechanism of action with a different brand name or a generic name. So be sure of that when you're doing it. And then again, most importantly, you want to make sure that we have adjusted the dose to the maximum effect or side effect. I mean, we are not going to go to the max dose if you're having side effects, of course, at a lower dose. But what I'm trying to say here is that if the way we do these trial and errors is that we make sure that we escalate the therapy up to the max dose that is available, and then we move to another one. And the key thing over here is that we want to make sure that the medication we have tried has actually failed. You see, we have to fail passionately. We have to do the full thing before we call it a failure, because we have to do that trial and error before we can move to the next medication. So principle number two, consistency. Routine, routine, routine. It is so important that you are consistent. You have the basic habits of having good hygiene. Anytime there is a disturbance, a late night, a flu, a travel, a stress, or anything, any chronic disease will get worse. So you have to have a significant amount of consistency. If you're doing alcohol, do the exact same thing every day. If you're going to do sleep, you sleep every day at the same time, wake up every day at the same time, because consistency matters a lot. It is a lifestyle thing as well. We're going to talk about it then in part 2. But if you're not going to be consistent with medication, with your life, with your lifestyles, with your sleeping habits, it is extremely important that then and then only we can able to control. Again, we can't cure, we can control these chronic disease processes. So the last thing, of course, the principle number 3 is measure to improve it. Like, it's very simple, but it's unfortunately extremely hard. If I don't know how these medications are impacting you, if you are unable to measure the improvement or worsening, I don't know how I can help you. So it's extremely important that we have that data so we can help you. So measure, 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 measure. Because if you're not going to measure, I don't know how to improve it. So therefore, if there's one thing you take away from this particular talk is make sure you measure your frequency of headaches, your type of headaches, your type of symptoms associated with your headaches. So there are tons of apps available for that. There are headache diary apps in both iOS and Play Store, or you can create your own spreadsheet and put it on it. I personally do not endorse a particular app, but there are definitely more than many websites in which you can find reviews of particular apps that will help you maintain a headache diary. Or in any other case, if there's glucose monitoring processes as far as diabetes is concerned, same thing, there are blood pressure monitors that put data into your app as well. So whatever you want to measure from your chronic disease process, measure it. And if you don't have the data, we can't improve it. Number 4, anticipate and abort. Now, as I said, consistency is the key, but there's times that we cannot be consistent, right? I mean, we are all human beings. My sister-in-law is getting a wedding done in Chicago. I have to travel there. There's going to be late nights. We're going to have some fun with the family. So there are things that we know. In that sense, when we actually know that we have to anticipate, we want to make sure that we have a plan to abort. Right? I mean, if you are going to have a big, huge cake, you just want to make sure that you have extra insulin near you. If you're going to know that you're going to have a little bit more alcohol and you're going to have more sleepless nights, make sure that you take a nap in the afternoon, or you have another abortive medication that is ready, or even take some of these abortive medications a little bit sooner because you understand that and you're anticipating. So therefore, anticipating is a very important thing. And same thing, I mean, so let's say if you're going to a city that is, if I travel abroad in Karachi or in Bombay, and if I'm asthmatic, that place is riddled with air pollution. So you want to make sure that you have extra inhalers or something. Any chronic disease that you can think of, whatever that abortive therapy requires, you need to anticipate that so that you can abort it if there's a change in your consistency of your lifestyle. So make sure you do that and make sure you always have a plan for it. Because the longer you make it linger on, then the problematic becomes, then you get hospitalized, then you're in the hospital, then you have to take steroids. Whatever that case may be, you're going to get side effects from that. If you have a plan to anticipate and abort, that would be fantastic. So make sure you have that. And most importantly, again, you can still have other problems. Unfortunately, sometimes even us as physicians have blinders. Hey, this must be a headache because you have a history of migraine. So am I really need a CAT scan over here to look for an aneurysm? There's a possibility you can have an aneurysm burst as well. So it is important that you understand that it is different from your regular headache. And that's, again, so important that you're measuring that particular problem. If you're not going to measure, and you can go back and say, okay, you know what? This headache is very different from all my regular headaches. So now you can tell the doctor and say, hey doc, this does not feel like my regular headache. So it is extremely important for us to know that this is not your regular headache and this is a red flag we need to consider. So again, if you have an infection, you're having fever, chills, and weight loss with your headache, we really want to know if it's meningitis or not, right? If you have any new neurological symptoms, we want to make sure that we know about them. So clearly, in all these situations, you have to make sure that you always consider red flags. And again, maintaining a headache diary is extremely important at that point as well. So in the next part, we're going to discuss lifestyle management changes in chronic disease management, specifically migraine. See you then. Thank you. If you save a life, it is as if you saved the life of mankind. Please make sure you like, comment, share, and subscribe to my YouTube channel and my newsletter. If you want to get in touch with me, the best way is to go through Twitter or via LinkedIn. Also, make sure you follow the Academy website for regular updates. Thank you so much.